Guys, welcome to my channel. So today we're going to talk about constipation. It's one of the most common cases in urgent care, especially with the children. So constipation, is when somebody is now unable to pass bowel movement for days, a day, or for a few days, and they're complaining of abdominal pain. It can range from mild to severe. Mild is like maybe you haven't have a bowel movement for 2 3 days, and then severe is when you have like fecal impaction is gone for a minute. In the children, you will see more of swelling themselves. You might have see a child having diarrhea. It doesn't mean like they're having diarrhea, but because this being the colon, and then the poop has impacted in the colon, so the poops will start leaking on the side. The watery poop will start leaking on the side, but in the fact that the colon is impacted. Okay, so what are the what do the parents need to do so that their children, to prevent constipation in their children, encourage them to eat fruits, a lot of fruits like oranges, mostly fruits, and then fiber. Oatmeal helps a lot because it has a high fiber content. Greens, and then encourage them to drink a lot of water. There's a if you give them a lot of milk can increase constipation. So make sure you're giving them a lot of water to drink. The children's, like from the age of 2 to 4, maybe you start potty training them. Some of them they get constipated because they're scared to use the bathroom. So you need to, when they go to the bathroom, you need to have what we call as a squatty stool, where the natural way they used to have a pit latrine. You sit down in a pit latrine, and your colon will have a natural way of passing the bowel movement down. But if you're just sitting on a regular, it's hard for them. So make sure you have a squatty potty stool under the toilet, so it can help them to poop or pass the stool easily. Encourage drink a lot of water. Okay, so that was all about the constipation, which is one of the common cases in urgent care. And then I normally recommend for parents, especially with the children from especially from the age of 2 to even the teens, you know, it's a good thing, like just asking the baby how was your day is one of the things that you need to ask them, like, did you hear about movement today, like giving a lot, making sure they didn't miss it, because I've had cases where parents bring the children to the clinic, and then you ask them like when was the abdominal pain, and then you ask them when was the last time they had a bowel movement. A lot of parents, they don't know what's going on in their children's life, but that's very important that you ask them, keeping a roster of like, oh, did you had a bowel movement today, did you had a bowel movement today. So anyway, that way it will help before the first thing. Anytime a child complains of abdominal pain, when was last time you poop? Is she having issues with the bowel movement, the peeing? And then ask them what part of the abdomen hurts, because you can go to the left lower quadrant, which more of constipation. If they pointed that area, that's more of constipation. So immediately give them a lot of water, and then start changing the diet. Sometimes there will be laxative, but they recommend the laxative to be the last thing, especially with the children, because you don't want to normalize for that to be the only thing, but changing the diets and increasing the water intake. Thank you. So if you like my videos, please click